InCommuity family. My name is Jose Delgado. I'm the Chief Operating Officer at InCommuity, and it is with great privilege and pleasure that I introduce a friend and former colleague, Dr. Rajiv Mallipudi. For those of you who may not already know him, he is a board-certified internal medicine hospitalist, physician, as well as a healthcare systems clinical researcher and passionate medical educator who currently serves as a unit medical director and physician lead for COVID-19 at Yale New Haven Health Bridgeport Hospital in the Division of Hospital Medicine. And if that wasn't enough, he also serves as a clinical instructor in the Department of Medicine at Yale School of Medicine. Dr. Mallipudi, how are you today?
Very well. Thank you so much for having me on board for these today.
Awesome. We're glad to have you. We're going to jump right into questions. Our staff and families have quite a few. And the first question is, what have you been seeing on the ground / hospital setting with COVID-19, and what does that progression of symptoms look like for patients who get especially ill?
Well, what makes COVID-19 so difficult to treat is that it's very similar to a lot of what we have as common flu symptoms or viral symptoms. And a lot of people feel weak and tired, a cough. But what also is unique is they have loss of smell as well as loss of taste. There's also development of diarrhea as well, and abdominal pain, kidney issues. Some of them could even have complications with stroke or heart attack issues as well. It affects different organs as we're trying to learn more about it. But the most common ones are people feeling fatigued, tired, short of breath, with cough, and also loss of sense of smell and taste. And what makes it also difficult is that a lot of people will have noticed over this pandemic is that it's very easily transmissible. So being around someone with coughing and then not being far away from them allows them to get it and be susceptible, which is why it's so important to wear our mask as well as to keep that social distancing. What we're seeing in the hospital is people who are very sick, most typically requiring oxygen to supplement them, in which they're able to keep their oxygen levels up. And we have to give a lot of that either through the nose, and unfortunate and very sad circumstances, sometimes have to intubate them, which we give them support through a ventilator. But there's a broad spectrum of what we see.
Wow. And, this week is an especially unique week in that the EUA for Moderna and the Pfizer vaccine is officially through. And a lot of our staff seem to ask a very common question, which really revolved around, do you trust vaccines? Who would you recommend the COVID-19 vaccine to? Are there microchips in this vaccine? What should we know about it? And do you trust it?
First and foremost, what we've done in the last few months as a world working together towards this pandemic is remarkable. And the fact that we've created a vaccine that is working is phenomenal progress. The vaccine has been known to have some rare side effects. The most common ones that have been noted are that people feel maybe some fevers or chills, overall some muscle pain, and just feel a bit tired for a few days. There have been no noted severe respiratory issues or side effects noted at this time, but those are the most common ones. So people may notice some redness or swelling around the area where they get the shot, but just feeling tired is the biggest one. But this has been tested with over 40 to 50,000 people in each of those different trials of the Pfizer and the Moderna vaccine. It's been noted to be safe, and those are large trials. In addition, it's been found to be very effective. In fact, after the first dose for the Pfizer vaccine, it's about 53% effective. And then when you get the second dose, it goes up to 95%. So it's very important to ensure that you're taking those sequences to be able to be vaccinated appropriately.
And a lot of staff.
There's no microchip.
No microchip.
There's no microchip at all. And also very important to know is this is not live or dead viral particles. It is not. You cannot get SARS-CoV-2 from this. You cannot get COVID-19 from this at all. Rather, this is through what we call messenger RNA, which goes into the system, and then the body recognizes and produces antibodies, which help fight the SARS-CoV-2 virus to prevent you having the COVID-19 syndromes.
Great information. And are you at all concerned about how quickly this vaccine was created, especially relative to other vaccines? Does that leave you with any kind of doubt in your mind that it could have side effects that we might not see and or it may not be effective?
Well, those are good questions and concerns as well. We have had this vaccine has been trialed in adults, and it's been found to have just very mild effects, which I've explained. It has not been tested on large trials on pregnant women, which is why it would be important to go on a case-by-case basis, discuss that with your OBGYN as well. There have been rumors about infertility. Those are not true and not warranted. The data has been looked at from the 40 to 50,000 people trialed in both of those vaccination trials, not having infertility issues. So that is a myth that is being spread, unfortunately, online with misinformation. But it's important to know that, yes, this has happened very rapidly, but also this is the only time in human history where you see pretty much the entire world working together on one effort to fight this. So it's a remarkable achievement in a very fast pace of time.
Here's a more specific question. This person is 65 years old, their son is 40, they're a special needs individual, and both of them actually already had COVID. Should they get vaccinated despite already having the virus?
Great question. So when you have COVID-19, when you get SARS-CoV-2, which leads to COVID-19, your body is going to have to produce antibodies when you recover. However, it's unclear at what point we are able to not get reinfected from this type of virus, which is why it's really important to use all the tools available, which is usually social distancing, the mask, as well as washing our hands. The vaccine is just another tool in our toolbox. In addition, our hope is that we're able to get our antibody levels high enough so that we do not get reinfected. And again, it's early on. We've just been around this virus for about a year now. We're learning more and more information each day, but making sure our antibodies are at a higher level is appropriate. And it's also unclear how long we're going to go to have this vaccine work. So it may be able to work for a few months, possibly a year. We're not sure. More information is going to come out as we look at these for long-term trials as far as how we do with the COVID vaccine. But what has been shown so far is that it's been effective, at least for the time that the trial was done, for both trials, and that it's able to be very effective, 94 to 95% of effectiveness of preventing you from acquiring the SARS-CoV-2 virus.
Got it. Another specific question, and this one's sent in several times. There's some people with unspecified autoimmune disease, and they want to know, should they be taking the vaccine? And maybe let's make this a larger question. Is there any group that shouldn't be taking the vaccine?
So as of now, if you have any particular concerns, I would recommend you discuss that with, maybe if you're like a cancer patient, discuss with your oncologist, or have severe allergies, discuss with your allergy doctors. It's a case-by-case basis. But what is a very common question that comes out is, hey, if I have an anaphylactic or severe reaction to some vaccines, I don't think I could take this COVID vaccine. Well, what's important to note is that reactions are case-by-case specific for each type of different vaccine. Some people may have allergies to egg that may be involved with vaccines. Some may have allergies to other substances in the vaccine. However, the SARS-CoV-2 vaccine uses mRNA. Again, it's case-by-case basis. So even if you had an allergic reaction in the past to some vaccines, it's important to discuss with your doctor as well. It would be appropriate to get this one. But if you do have those concerns, please discuss with your doctor.
Got it. Great answer. So this next question, this individual wants to go on vacation, in particularly the beach, and they're talking about traveling by themselves and going to a hotel, and they're going to wear a mask and a face mask and gloves where applicable, and use sanitizer every second of the day. Is that enough to stay COVID safe? Is there something else people can do, especially if they're traveling during the holidays?
Oh, great question. So fighting a pandemic involves using all the tools available. And right now, the tools that we only had available until this past week is really our masks, social distancing, washing our hands. Moving forward, having all the tools available with the vaccine helps us involve herd immunity, so both yourself and everyone else in society is also protected. So it's absolutely critical to be involved and get vaccinated to ensure that you're safe, as well as everyone else, so we can get back to living the life that we want, which is traveling and going to concerts and sporting events.
Got it. That's a great answer. And what recommendations would you give to staff and families who care for those with intellectual and developmental disabilities, especially during COVID times?
Well, as we've seen, unfortunately, with this pandemic, it really has affected people's mental health. People aren't working as much. People are home more often. It's just, unfortunately, a very difficult time with these quarantines. So most important thing to do is really provide that support. Fortunately, the younger population and even those with special needs do not have the high risk factors for acquiring COVID-19 syndrome in the same way as older patients with heart failure, diabetes, or high blood pressure. But at the end of the day, they can all still be affected. So providing that emotional support, helping them through this, and still encouraging the use of social distancing and precautions and hand washing, and also wearing a face mask is absolutely critical.
Great. And last question, how long after taking the vaccine do you think we're going to have a noticeable change in COVID numbers?
It's difficult to say. As of now, the vaccine just came to our system. I'm getting vaccinated hopefully next week. We're going right now in alphabetical order, but you got a lot of people that need to get vaccinated. First, the healthcare frontline doctors, such as myself, nursing staff, techs, everyone else in the front line and healthcare field. And then as it spreads throughout, the idea is that you hopefully get the whole population be able to get vaccinated. Right now, there's no one forcing anyone here at our healthcare system to get vaccinated, but it's something that's highly encouraged. And for most of my colleagues I've spoken to, we all feel very strongly about it. It's safe. It's been used on large studies, and we're going to do it. And how it allows us to be protected, as well as the people we work with each day, which are the most vulnerable.
Well, if you guys, the most knowledgeable physicians and nurses, are getting vaccinated, especially at an institution like Yale, New Haven, that gives us a lot of confidence as well. Dr. Mallipudi, you've been absolutely phenomenal. We are so grateful for you joining us on today's talk. And that's it. Thank you so much.
Thank you so much for your time, Jose. And I encourage everyone else to be safe over the holidays. Merry Christmas. And please, as much as we want to be with our loved ones, be careful, wear a mask, practice safe social distancing, wash your hands, and let's do our part. And when the vaccine becomes available, I encourage you to get it as well, so we're all protected. And hopefully we go back to living the way we were a few months ago.
Oh, yeah.
Take care.
Thank you. Bye.
Thank you. Take care.